that'll help our citizens. And in Jesus' name we pray, amen.
Thank you. Shelley, would you please do the roll call?
Yes, ma'am.
Thank you.
Mary Baker Shaw,
Connie?
Mike Dobbins. Here. Keith Austin. Here. Hurley Buzzard. Here. Joe Byrd. Here. Julia Coates. Here. Sean Crittenden. Here. Joe Deere. Kanan Duncan. Here. Rex Jordan. Here. Darrell Legg.
Here.
Wes Snowfire. Dora Petzkowski. Here. Mike Shambaugh. E.O. Smith. Here. Janice Taylor. Here. Victoria Vasquez. We have a quorum.
Thank you so much. Approval of the minutes. Has everybody, could I get a motion to approve our minutes of our last meeting?
Make a motion.
Second? All those in favor say aye.
Aye.
Thank you. And our first report, he's here today, Mr. George Valor. It only took 4 years.
Oh, you did good on the name. Must have been taking French.
Good morning, Mr. Valor. How are you today?
I'm good. Is that working?
Yeah, we're so glad you were able to join us today.
Oh, it's always a pleasure to be here. You have my report in your packet. You can see that our visits are increasing. Our collections are almost back up to where they were pre-COVID, so that's a good sign. We continue to give vaccines there in the hospital. We continue to do testing out of the emergency room. Our 7-day positivity rate is at 5.8%. Dental last month, for the month of May, had 419 patient encounters. The lab had 2,263 patient encounters, ran a total of 3,400 and just over 3,400 tests, 34,000 tests. Pharmacy filled, the outpatient pharmacy filled 27,563 prescriptions through the outpatient side. We continue to work on the property just to the west of the hospital, trying to get that ready to move in. They've told us that we can expect the keys sometime after August 1st. That's where we're going to try to move some of the business functions over there and do some remodeling to create more clinic space there in the hospital proper. So hopefully we can get that going by next year, the remodel inside. Any questions?
Council have any questions for Mr. Valor?
Mr. Valor, what, I was looking this morning on all the hot spots on this Delta variant, and they said the hot spots were Florida, Louisiana, Arkansas, Missouri, and Nevada. And Southwest Missouri is really having a difficult time. Like they got like 90% of their people on ventilators. Do you see an increase there in our ICU yet?
No, sir. This morning we had one person in the hospital with COVID, and they were not in ICU. And like I said, we just have right now we just have a 5.8% positivity rate on our test. So that hasn't moved down to us yet.
That's good news. All
yes.
Right. Thank you, Madam Chair.
Thank you. Anyone else with any questions? Mr. Valor, I have one. With the Creek Nation opening the former Cancer Treatment Centers of America building and the hospital, and then opening it as a clinic, do you think that will affect your patient load very much?
It could. I look at it as a plus. It just more access for all of our patients. We share patients between all of us, and it's better for our patients. I look at it as a plus for us.
Very good. Good. I know a lot of people are excited about that.
Yes.
More specialized care. Anyone else with any questions? Well, oh, yes, Counselor Buzzard.
Well, George, this is probably going to be my last committee meeting with you. I'm terminally limited out, so I won't be running for tribal council, so I won't be sitting here. I just want to tell you that I enjoyed working with you. Your reports have been really, really well. You've answered all of my questions about the hospital there in Claremore. I think the citizens from my area, well, I don't want to say they're treated different because we're just in a different service unit. And our payments through the Cherokee Nation Contract Health has really been good for the last four years or so. Before, it wasn't quite so good, but now we're up to 96, 97%
Yes, sir.
approval rates. But I want to tell you, I enjoyed working with you, and when I called you, you've always answered my questions. So I just want to tell you that today. In case I don't see you again, I want to say good luck to you, and thank you for taking care of our citizens.
Oh, you're welcome. Thank you.
Thank
It's been a
you.
pleasure.
Yes, Counselor Dobbins.
This might be for Speaker Byrd. Our August calendar, I mean, Councilor Buzzard just said this is possibly his last Health Committee meeting. Is that the case? Or will there be an August council meeting before Councilor Buzzard's off the council?
Shelley, you want to answer that? I think we may have one more. I think it's August the 9th. We moved that up because the inauguration is like the 12th, is that correct?
Inauguration's August 14th, which is Saturday, and the regular council meeting and committee meetings on Mondays would be that very next Monday on the 16th. So it was kind of a decision to move them up a week to August 9th and then give all you guys terming out one more set of meetings.
So Harley, don't resign yet.
Well, so I may have one more council meeting.
Okay.
So let's see. All right, thank you.
Mr. Vallier, thank you so much
Thank
for
you.
coming down today. Okay, next up, Wayne Cowwell, I believe is here for Dr. Jones. Yes. Good afternoon, Mr. Cowwell.
Good afternoon. Thank you, council, for having me again. Glad to be here this morning, or this afternoon, this morning before. The reports in your packet, I did want to highlight a few points. Mic's on now? Good, okay, good. All right, I wanted to highlight a few points in the packet that is in front of you. In closing today, I will hit on some current COVID statistics that we are seeing within our healthcare system. So just bear with me as we go through this. On the Health Committee report, you will see in the month of May we did celebrate Hospital Week, Nurses Week, and Emergency Medical Services. We it was unfortunate that we weren't able to celebrate like we have in the past, but we made the most of it and honored those employees that day in and day out are doing great work. In the month of May, 62 babies were delivered at the hospital. I like to highlight that point. I think that's great. We see a great return on our babies there, so good stuff. Provider recruitment. We have a 4.4 provider vacancy rate versus the Indian Health Service provider vacancy rate of 25%. Contract health, we had a 95.9% approval rate on the referrals for the month. The last thing I want to hit on before I get into the COVID statistics is vaccine. We've administered 65,000 vaccines to date. That was through last Friday. I think that's a very important thing to highlight. Medicaid expansion, I hit on this briefly last month. We have enrolled a little over 2,000 Medicaid recipients. And these are not, I want to be clear, these are not renewals of Medicaid. These are new Medicaid eligible patients that we serve. So lots of good work going on that, 2,000, a little over 2,000 to date. Getting into the COVID data, the variant data, I wanted to give some statistics from through last week, and then also a current state of our hospital as of this morning. Last week, we had 166 positive cases. week over week, that's an 80% increase week over week. 90% of the positive cases were unvaccinated individuals. I want to repeat that, 90% of the positive cases were unvaccinated. We're testing just over 200 per day. We're averaging 25 positive cases per day. Variant data is something that we get requested from. I want to be clear on that. That is a state data that they produce. We do not produce that at this time. It is very specialized, and they're working on getting that information out for all of us. If someone does test positive, we are encouraging them to go to the local health department to have that variant testing that they can through the state. Current state with the hospital, as of this morning, we had 5 patients in the hospital that had COVID, and there was 0 of them were on a ventilator. So that is good news. Hopefully that we get them back on their feet and they're back out in the community. Positivity rate. Councilor Buzzer, I know that's something you like to hear, and I'm sure all the council does. The week before, it was 6.8. This last week, it was up to 12% test positivity rate. I think that's all the COVID information I have. And just in closing, please encourage your friends and family to get vaccinated. If there's something that I can do or that health services can do to increase vaccine acceptance, please reach out to me, and I would gladly extend an arm to help anyone I can.
Thank you. Councilor D?
I got a question, Wayne. This Medicaid expansion, I've got a couple of calls. I'm not that familiar with it. Somebody said the Medicaid might be ending, but it won't end until they send a letter out to those people. Do you know what the rules are or what's going on with that?
I don't know, but if you can give me the instances, I would gladly look into them and see exactly what there's lots of different avenues through Medicaid that we work through, so
Yeah.
would gladly look into those cases for you.
Because what it came down to is with their billing or something, and they were worried about that. So if they were worried they were going to get shut off and the bills that they did not receive, then they would be responsible for that.
Okay.
So I'm not real familiar with it, so I was hoping you might know.
Yeah, let's get together after this, and if you give me the instances, I can kind of look into those
Okay.
cases for you. Okay?
All right, thanks.
Councilor No Fire?
Yeah, I had I don't know if you can get if you had the answer, you get it for me, but I was just recently at the hospital, went through got a whole thing done. I went in and had an emergency situation. We don't know exactly what it was, but received CAT scan and EKG and everything. Everything came back normal, and the staff was great. Can't complain about it. But when I was there, we had to go up to get an MRI from the ER to Hastings. And whenever we went there, it's something that I think has always been a problem, and I just have never experienced it as the problem. Having to be wheelchaired all the way across, and then across moving traffic, a parking lot, to get up to the new clinic to get an MRI. And that is a dangerous concern. I mean, it's not only putting myself or the patients or the staff at risk, but it's also, we went in through the main entrance and wheeled past everybody else. So it's also an exposure thing. So, I'm an elected official, which does cause questions from citizens that I'm being wheeled by with an IV going to who knows where. But it's also a concern for anybody else who doesn't want to be seen by the public that they're in there being sick at the time. Nobody wants to go to the hospital and know that they're unhealthy at the moment. But what would it take, and are there any restrictions from creating a sky bridge? I mean, we've spent millions on stuff that didn't have to do with healthcare, but yet that being a real concern that we should be using, last COVID money for, but obviously this amount of COVID funds should be looked at it being used for building that. Is there any restrictions that you know of that would prevent that from happening?
There are some building and codes restrictions that would obviously have to be looked into, or see the feasibility of it, and that we definitely could take that as a note and look at any future opportunities that we do that. The other thing I want to hit on just briefly is the number one dangerous thing to do for a patient is to transfer a patient, right? And we have to utilize the assets that we have, or our infrastructure that we do have in place currently. And, having an MRI across the road is not ideal, right? But we will constantly evaluate what infrastructure needs we have and ensure that we, you know, are taking care of the patients the way that we should. We will, Councilor, if I 100% hear what you're saying, you're not the first person to bring that to the table, but we're constantly looking at ways to improve our access.
Have you already looked at some of the restriction building guidelines between those two?
They did when the new outpatient health care facility was being built, and I don't remember all those, but we'll gladly share.
Okay, great, yeah, if you could follow it back up with us on
Understood.
that, that would be great to look forward at trying to get that done, because I know it's a concern for a lot of people, so appreciate it.
Understood.
Appreciate it, Chair.
Counselor Buzzard.
Well, Wayne, since I thought this was my last committee meeting, I had some things and concerns, but I'll go ahead and mention them to you, and then
Absolutely.
if I need to follow up next month, I'd be glad to do it too. So there are just several items here that I want to make sure that I presented to Dr. Jones or to you. But the first one is a mammogram machine there at the J Clinic. That I understand we don't have one. And what happens, they used to have a mobile unit that came in there, and there was some policies about if you had insurance, you went to Salina. If you didn't, you used a mobile machine. I guess my question is I'm requesting a mammogram machine be installed there at the clinic, because now they have to go to Salina or to Veneta or other places, and what I understood that most other clinics have those machines, and I don't know that to be true or not, but if you would check onto that, you know, that's one request that we'd like to have there at Sam Hyder. The other thing is, I've had a lot of, and I think we've discussed this before in this health committee, but, and I think it would work for all clinics, or maybe some different clinics, is urgent care. I've been approached by several people about if we had an urgent care clinic at our clinics, it would take a lot of patients away from patients that are trying to see appointments, and I think you guys are well aware of that. So if there's any money that can be used from this COVID funds to get one started like that, I think people would benefit from it, and so would the providers at our clinic. The other thing that, and I brought this up before with Dr. Jones, and I want to bring it up again. At the Sam Hyder Clinic, the parking lot is a long way from the clinic door itself. And I've been approached by citizens about getting a canopy walkway on the sidewalk going up there, because if it's raining or whatever it's doing with the weather, you know, it certainly help those people. And I know we have the drive-up circle and stuff, but and that's another thing that I want to talk about just a little bit more. But anyway, the walkway, if we could take a look at that, that would be appreciated. The other thing I'll just give you an example. It may be easier to do it that way. I had a patient that lives alone, and they have COP real bad, and they'd use a walker to walk, and they can't walk without assistance. They drive up to the clinic, and they really can't walk from the parking lot up to the door. So what we'd like to see is a cart to pick people up. The other thing, and I've thought about that, and I see some of the problems with it, because, you know, you can't be on standby all the time waiting on that patient, and there may be only one a day that does that, or maybe 10 a day. The other thing I thought would maybe help alleviate that is we had a button before you drive up there where they could push and a speaker to say, hey, I need assistance. That way you wouldn't tie somebody up all day to do it. I realize we have security, but, you know, they may be on the other end of the building when somebody pulls up. So what I'm trying to say is if we could just make it easier for handicapped patients. There was a veteran citizen there the other day, and I happened to be there, and he walked up to those posts outside, and he rested. And we asked him, you know, what, can we help? He said, well, I just can't make it. I drove up here by myself, and I can't really walk from the parking lot to get in there. So we went in and came back out, and he'd made it from here to Councilor Austin because he just couldn't walk. So that's really a big concern there. And I think we probably have some people that can figure that out. You know, if you put a button outside, it rings to security or someplace. But I wanted to bring that up because I thought this was my last day, and I thought I better get it in there. But anyway, if you could check into that to see if there's something we could do to help that. The other thing is, and I don't know, maybe I need to address the clinical director about this, is we have a drainage ditch, and this is a fairly new clinic. It's been there 5 years now. And they keep the grounds really looking nice. But there's this concrete drainage ditch in front of the clinic, and it fills up with debris, and it's silt is what it is. And I'd ask them to, and maybe it's not their job, but I've asked them, why don't we have our maintenance people just go out and clean it out to keep it looking nice? Because if you don't take care of the maintenance on looking good for your clinic and stuff like that, it starts to look like it's run down. So far, the clinic has looked really well. So those are just some things, and I'm sorry, that I had to bring it all out today, but I thought today was my last day here on the job. But anyway, if you could take those notes down, and if there's any questions, just feel free to call me, and I'd be glad to address them further if I need to.
Understood. Thank you, Councilor
Okay.
Buzzard.
Thank you for your service here, too.
Thank you.
Thank you, Madam Chair.
Thank you. Anyone else with any questions?
You mentioned, Mr. Cowwell, we had 166 cases with almost 80% increase. What percentage of those would that be the variant?
We don't have any solid data on the variant to date. We're hopeful that we have that back from the state within days or weeks. It's relying on them to get us that data.
Well, I'll tell you what, we're doing a good job. We're still not one of the hot spots yet. So Cherokee Nation has really done an outstanding job, you and your staff, Dr. Jones and leadership. So appreciate everything that you've done.
Thank you.
Thank you, Madam Chair.
Thank you. Councilor Shambaugh?
Well, if you look at the other states like Arkansas and Missouri who have just blown up, I mean, that is the variant. They've got the variant, so it would probably be safe to say that we have it too. So, but that also goes to show that the vaccines are working against the variant, and that's at least some positive news, but I think it's here. Would you agree?
I was speaking with Dr. Montgomery prior to, and yes, we don't have solid data on that to date, but that is present. Correct, it is.
Okay. Anyone else? Yes, sir.
Madam Chair, I had one more, and this is, I'll list the TVs for the clinic up there. I had talked to Dr. Jones about it, and I think they were ordered, I don't know, several years ago, and something happened with installation of them. So if you could check into that, because I had citizens say, well, we'd like to have updates. We'd like to see the council meetings or committee meetings if they're in progress and things like that. And I think they're good just for public information. So
Absolutely.
if you could check on those, I would appreciate that also.
Thank you.
Thank you.
Anyone else? Okay. I have just a few, Mr. Cowell. Mr. Cowell, in the future, is it possible we could get the top 3 diagnoses at each clinic, each facility? We used to receive those, and I don't know what happened to them. But if you could see to it that council's given that, thank you. And then my next question, I wanted to talk about our vaccines. Are we seeing the 12-year-olds up? Are they showing up for these shots?
There are today, we still are giving vaccines, I shouldn't say handing, giving vaccines out. I don't have a breakdown of the age population, but we can dig into that data and get that for you.
Have we had any cardiac situations arise from giving them to the younger group?
To my knowledge, no.
To your knowledge, no? Okay, trying to think if there was something else I wanted to ask. Your Doc's Rock concert is next month, is that correct?
No, that is in September or October.
Is it September or October?
October, yeah.
September.
September.
Well, that sounds like a fun event. Anyway, and they deserve to party and have a good time. They're like heroes to all of us and to our nation, and we appreciate that.
Absolutely.
And that being any other questions? Thank you so much.
Thank you all very much.
Okay, do we have any old business? New business? Any announcements? I've got that the next meeting is tentatively scheduled for Monday, August the 9th at 1 p.m. There being no other business, I'd take a motion to adjourn. So moved. Second? Thank you.